This is Dr. Stephen Harkins. Welcome to Anatomy Coloring Book, page 39. The knee joint. All right, so we've learned more. We've learned about the femur, this long bone with the condyles, right? The medial and lateral condyles. That's this bone right here. And we've learned about the tibia, which is this lower bone here. Now we're going to talk about how they interact with each other. First, notice the articular cartilage on the end of the femur. This is a very, very slippery connective tissue, slippery cartilage. And on the end of the condyles of the femur and of the tibia. That's the cartilage, the articular cartilage. The space in between is called the synovial cavity. This is the synovial cavity, or space. An empty space, but actually it's not that empty, is it? It's filled with synovial fluid, very, very slippery synovial fluid, and it makes sense that it would be slippery, right? We want these joints, these two surfaces, to be gliding almost friction free. Surrounding the knee and encapsulating and keeping the synovial fluid inside of the synovial cavity is the joint capsule. It's a connective tissue, kind of like a ligament, that surrounds and encapsulates the entire knee joint. So the capsule would be, surrounding and encapsulating, keeping very tight the fluid inside of the knee. There are bursa, little sacs, in certain areas of the knee that prevent friction. For example, here is the tendon, the quadriceps tendon, or the patellar tendon right here. And you can see with all the up and down movement of the knee as the knee flexes and extends, that this might be an area of friction right here between this tendon and the femur here. So it's a good thing we have an area here called the bursa, the suprapatellar bursa. It's a sac of fluid right here, and it helps with friction. And you can see there is an bursa, an infrapatellar bursa as well down here. A sac of fluid, and here's the patellar tendon right here, connecting to the tibial tuberosity, and you could see that that might be an area of friction. So we have bursa underneath, kind of mitigating the friction in those areas. And bursa, you've heard of bursitis. Bursa can become inflamed, just like the joint itself or any other structure. That's called bursitis. Now, deep inside the knee, in this area here, we have ligaments inside the knee, and you've heard of these ligaments before in sports, the ACL and the PCL. They're called the cruciate ligaments. Cruciate, like the city of Las Cruces, means the crosses in Spanish. So cruciate means cross, and you're going to see why. We have the anterior and the posterior cruciate ligament. And here is a view of the cruciate or crossed ligaments and how they work. And you can see the two ligaments right here. This is the anterior cruciate ligament right here. And what it prevents is forward translation or forward gliding of the tibia. You can see if this tibia were to move forward, slide forward like this, that this ligament, this anterior cruciate, would start to stretch. And what it does, if this is pushed forward this ligament will pull back and keep that tibia from sliding too far forward. Of course, in a tragic accident, such as we see on the fields of athletics, sometimes it pulls, the force is too great, and that anterior cruciate ligament will tear. It will become torn. And the opposite, there's an opposite ligament as well, and it is called the posterior cruciate ligament. And what do you think the posterior cruciate ligament does? Well, of course, it resists posterior translation or gliding. The cruciate ligament, the posterior cruciate ligament right here, prevents, if you take a blow, if somebody kicks you in the front of the knee and it pushes that knee backward, well, the posterior cruciate ligament is going to pull and say, no, I'm going to not let that happen. You're not going to be able to extend this knee backwards and slide it back. Of course, if the force is too great, that ligament could tear, and that's the posterior cruciate ligament. So the posterior cruciate resists posterior glide of the tibia, while the anterior cruciate ligament resists anterior glide of the tibia. A quick word about the posterior, about the joint capsule. It is certainly found on the posterior, but there are other areas here where we have ligaments that are covering, that take the place of it. And in the front here, the patella takes the place of the joint capsule. So the ligaments of the knee, the medial collateral and lateral collateral ligaments, and the patella, and the other structures sort of act as the joint capsule in other area, as it surrounds the joints. But the point being, it's a tightly wrapped joint with a fluid inside, with some joint capsule and ligaments and the patella, the patellar tendon, for example, that also help encapsulate this fluid inside. Also found inside the knee joint are these little structure called meniscus or menisci. And they are these little triangular structures right here. They're little pads right here. And they are cartilage. Meniscus is cartilage. There's one on the lateral side, and there's one on the medial side. The lateral meniscus is this structure right here, looking from down on the tibia. We've taken the knee apart and we're looking down on the tibia. And this is the lateral meniscus of the tibia. And this is the medial meniscus of the tibia. And you can see how they sit on top of the tibial condyle here, the meniscus. And here's a view of them here from the upper direction. And here's another view of it right here. Here's the medial condyle. This is the knee completely flexed and kind of opened up, and you can see the patella right here is folded back. It's cut right there and folded back, exposing the front of the knee. And here's the patellar groove, or the intercondylar groove, which the patella slides on. But here is the medial meniscus on the medial side of the knee. And here is the lateral meniscus. It's under here somewhere. Let's see, yes. The lateral meniscus on the lateral side of the knee. These menisci kind of create a more of a groove, right, for the condyle, for the femoral condyle to ride along in. So the tibial condyle, looks something like this, slightly concave, but then the addition of these meniscus, these cartilage, little pieces of cartilage, is that it creates a nice little sort of cup or a holding spot for the femur to move, to slide nicely back and forth into. And there is a little bit of rotation in the knee, by the way. The knee is not just a back and forth joint in the sagittal plane. There's a little bit of rotation in the knee in the transverse plane. little bit of twisting that's allowed. Not too much. You don't want too much, but there's a little bit that's part of the natural knee motion. That's the lateral and the medial meniscus, the cartilage inside of the knee joint. Notice that they're attached to the tibia down here and not attached to the femur. The femur rides along, glides along the menisci, but are not attached to the menisci. They're attached to the tibia, the plateau, the tibial plateau. Now let's talk about the ligaments of the knee. We've already talked about the posterior and the anterior cruciate, and let's look inside of this diagram here. The anterior cruciate ligament right here. And remember, this is the patella is pulled, resected, and cut back and pulled away. And here's this crossing motion of the anterior cruciate and then the posterior cruciate ligament. They're crossed. Called it the anterior resists anterior glide of the tibia, and the posterior resists posterior glide. But there are two other ligaments, the collateral ligaments, right here. The collateral ligaments of the knee. There's the lateral collateral ligament and the, or also known as the fibular collateral ligament, most commonly called the lateral collateral, or the LCL, and the MCL, or the tibial collateral ligament, obviously because it's on the tibial side here. Here's the tibial collateral ligament. So if you were to receive a blow on this side of the knee here, it would bend the knee this way, and it would be this medial collateral or tibial collateral ligament that would stretch and try to keep the knee from being caved inward. On the other hand, if you were to receive a blow from the inside or the medial side, the inside of your knee outward, it would be this lateral collateral ligament or fibular collateral ligament that would have to resist that and fight that and keep your knee from caving in outwardly. A final word about the patella and the groove on the femur that it slides in. Notice the shape of the patella here. It sort of has two different facets or facets. You know, one facet here and one facet here. And notice the groove that it slides in over here. Keep in mind, it's been cut at the top here, and it flops over here. See this here? Right here, it's a patella. It flops on top. So this patella, this is the bottom underside of the patella. And imagine it being flopped over here and riding in this groove right here. This groove created by the femur, this intercondylar groove. And these two facets or facets, they interact. This facet right here interacts with this part of the femur, and this interacts with this part. And you can see there's a groove, and right in the middle there's a prominence here, area that raises up, and it fits in this little groove right in the middle there. And I'm Dr. Stephen Harkins. This has been page 39 of Anatomy Coloring Book. Until next time.